in common, it gives you a little bit more motivation, a little more strength to be able to implement those changes, because quite frankly, you're seeing very specific things that are repeating over and over again. It gives you a little bit, and therefore, when you see these things on a regular basis and you have a different lens to look at things, then it makes it easier for you to make those decisions for yourself. All right, so let me share my screen and we will get started. Okay, one moment. All right, so you should see my screen here. If you have any questions, do let me know. See, we have a few people coming in further. As always, you can ask me any questions as we go along. And really, this could be entitled Enhancing Vascular Health, but I called it Enhancing Blood Flow because we're basically starting from the lowest part, thinking about the blood and the blood flow. And then we'll move into sort of what diseases are associated with blood flow, what the endothelial cells do, because that's really key to understanding not only what you can do to improve your vascular health, but just having a general understanding of the vascular system. Then we'll talk about healthy vascular aging and what has actually been studied to improve vascular aging. In other words, as we get older, there are certain changes that happen to the blood vessels in our body. And there are certain modalities, certain types of lifestyle changes that one can make that can be helpful to minimize the natural aging of the vascular system, of how the blood flows through things. Then I'm going to spend a little time focusing on nitric oxide, and you'll understand why that is, because nitric oxide, which is, believe it or not, relatively new in science, but basically it allows the blood vessels to open. And if your blood vessels can't open, there's a whole host of problems that can occur. And we'll focus a little bit on that and how to improve nitric oxide in the body so that you have blood flowing the way you want it to flow. And then we'll end tonight talking about foods that can improve your blood flow through various different mechanisms. So let's get started. I see we have some other people who have joined. Welcome, everyone. Hi, Sheila. Hi, Russell. Hi, Helen. Okay. All right. So let's start from the very, very beginning. And this is very basic, and many of you probably are going to know a lot of what I'm about to talk about, but we'll go through it relatively quickly. So, basically the blood flows from the heart, and I'm just going to blow up this one moment. See if we can blow this up a little bit. So basically, this is what your blood vessels look like. And this is sort of a cross section. And what you have is you have that thin layer of endothelial cells. Those are the ones that coat the blood vessel, as you can see right here. And it's one cell layer thick. And then you have smooth muscle cells. And these smooth muscle cells are actually there to be able to contract so that the blood vessel can contract or it can open. And there are reasons for that we'll go into a little bit later. Now, when the blood leaves the heart, it's basically going into an artery, and then the artery becomes an arteriole, which is basically a smaller artery, which then goes into the small capillaries, and then into what's called a venule, and then into a vein, and then that comes back up to the heart, and then into the right side of the heart, and then into the lungs. And then it goes out the aorta into... The aorta is an artery, and then this thing cycles through over and over again. So basically, it starts with a big blood vessel, goes down, 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 gets smaller, smaller, smaller. In fact, in the capillaries, you can actually, in most of the capillaries, only move through one red blood cell at a time in a lot of these small capillaries. And that's why people with, say, sickle cell anemia, they have these red blood cells that are sickled, that they look like actually a sickle. And what happens is they can get caught in these very small capillaries, and that can affect blood flow. And that's what causes a lot of the pain in sickle cell anemia. Anyway, this is basically how the blood vessel looks, and you'll see why that's important. Now, I mentioned that muscles are important. Obviously, the heart is a big muscle, which is responsible for pumping the blood. But a lot of people don't realize that once you get into these, not just the the veins, but also the arteries, but especially the veins, you need you need the muscles in your body to be able to contract to force some of the blood in the veins back up into the heart. So that means that exercise, when you're contracting, say, the big muscles of your legs, as an example, that have veins around them and in them, then you are contracting the blood in there. So your muscles in your periphery are acting almost like a heart, in the sense that it's allowing the blood to continue to move. When people are bedridden or, say, standing up all day and not moving that much, the blood has a tendency to pool. And as you know, when we're young, the veins have a valve, so that when you stand up, the valve closes and it prevents the blood from actually pooling and getting out, and fluid getting out into the tissues. But with age, those valves can get kind of weak. And when you stand up, the valves will just sort of fall, and the blood will flow down, and then the fluid will come out. And that's what causes the swelling that people get in their legs. So it's very important that if you're on your feet a lot, especially as you get older, that you want to help the blood get back up into your heart. Then you can do that by moving around and doing a little exercise, standing on your toes, doing what you can, and then also wearing compression socks as you get older if you're starting to get some fluid leaking into your legs. That can be very, very helpful, because it can help prevent the blood from leaving the blood vessels and creating that edema. And when you have edema and swelling in the legs, that can cause a whole host of problems, including delayed wound healing, and changes in the pressure of the legs, which can ultimately affect the vasculature, the blood flow that's going there. So anyway, that's basically the basics of the vascular system. So what diseases are associated with blood flow? Well, you know most of these. Heart disease, of course, and the reason being, of course, that the vessels in the heart can get blocked, and therefore that's essentially one form of heart disease. Peripheral vascular disease, which is basically where you're just not getting the blood flow into the periphery, into, say, the legs, which is resulting in decreased blood flow. And that can cause cramping and ulceration sometimes, a whole host of problems, and really can be a very significant problem for people who want to maintain activity, because if the blood is not getting where it's supposed to, and you have peripheral vascular disease, then you can get cramping because the muscles are not getting the blood flow that they need. Blood pressure, we'll talk more about that as we go into it, is associated with blood flow, because as we'll talk about in a little bit later, with healthy vascular aging, there is basically the arteries tend to get very stiff. When you're young, your arteries are very elastic, and we'll talk about why it's important for them to be elastic, and because we'll go into that in a little bit. But essentially, it's associated with blood flow because it's going to be associated with the blood and the pressure of the blood in the vessels. Strokes, of course, are associated with blood flow as well, either because of a clot or because of a rupture. And we all know that there are many, many causes, but they are ones that all of us recognize, that we end up talking about every single time that we are on an episode. We're already episode 43 tonight, and we probably have mentioned these in almost every single lecture that we've done, almost every single episode. So sedentary, now you can understand a little bit more why, because if you're not exercising, we spoke about the elasticity of the artery, but also obviously blood can be pooling. If you're not moving and exercising the muscles, the blood is not going to be flowing the way it's supposed to. I just want to stress again that we really need to think of exercise as moving the blood, not just because our heart is elevating and are beating faster, but because we're contracting the muscles, and we contract the muscles, that is causing the blood to move through the body even more. So we have to think of our muscles as an external heart that is allowing us to be able to force the blood and keep the blood moving, because as long as your blood is moving and it's moving well and it's moving without abnormal increases in pressure and is getting where it's supposed to be, then that is a state of health. Obviously, obesity, of course, smoking is going to constrict the blood vessels and inhibits wound healing, which is another reason why it inhibits wound healing, is because you're not getting the blood flow that you need, in addition to the fact that it's increasing inflammation. Inflammation you need in the body to be able to initiate, as an example, wound healing. But if you're compounding that inflammation with smoking, on top of the normal healing inflammation that you need for wound healing, it's going to cause a great deal of problems. When I do minor surgery on people's faces, if I'm removing, say, a skin cancer, if they smoke, we always tell them that, unfortunately, with smoking, especially on the face, the wound healing is just really terrible. In addition to that, the fact that associated with smoking is this inflammation that can also cause increased wrinkling as well. So there's the inflammation, and there's also the vascular effects are going to really premature age people. And I see it all the time when I'm seeing patients that, unfortunately, smoking just not only does it age your entire body, but from a physical, cosmetic perspective, it's so incredibly noticeable that that it's unfortunate. Excess alcohol, obviously, there's some people who say a little bit of alcohol can help by dilating the blood vessels. Generally speaking, though, alcohol tends to be a toxin, but here we're specifically talking about excess alcohol, of course, poor diet and stress, and we'll go through a little bit of those as they touch various factors of what we're talking about as we go through tonight's talk. So we spoke a little bit already about endothelial cells, and now we're going to talk a little bit about what these endothelial cells do and why it's important to have an understanding of them before we get into the lifestyle modifications that are going to be important for you to understand. So basically, the endothelial cells are, like I said, that very one cell membrane thick that surround and act as a barrier for inside the blood vessel. So think about it as sort of that thin, shiny, like if you cut a garden hose in half, and it's got sort of a shiny coating in the middle. That's your endothelial cell. And that shiny coating, even in that particular garden hose, is very, very thin. And same thing goes here. It's a very, very thin one cell layer. But it does so many things. It's amazing that this one cell layer can do so many things. For example, it can sense mechanical signals. And what it does is it communicates to the smooth muscle cells that are underneath of there. So we spoke about up here, when I showed you that picture, you see in here the muscle cells. And we spoke a little bit about how they contract and they relax. Well, the endothelial cells are basically reading what's going on in here and saying, well, I think we need to dilate. I think we need to relax, in other words. And when the muscles relax, the blood vessel opens. So that's really what's happening there. It can grow new vessels. So as an example, here's a picture that I found from this textbook, just to make this very simple: low oxygen, high oxygen. Now, if we have high oxygen, we don't need any new blood vessels. But if we have low oxygen in the tissues, then we need a new blood vessel to provide blood and oxygen. And remarkably, these endothelial cells can sprout out and form a new vessel to feed this area of low oxygen. So when you see those big bodybuilders and they've got all that incredible vasculature, it's because as your muscles are growing, if they didn't grow new blood vessels, then there's going to be a problem. They need to be able to grow, and therefore they need more vessels. And so the endothelial cells from the capillary basically sprout out and put a new vessel in here. Same thing can happen in the heart when there's not enough blood vessel. It's amazing that what can happen is you can get these accessory vessels that happen to naturally bypass the area to feed oxygen and blood into areas of the heart that are having trouble. And it's remarkable, really, isn't it? I think it's miraculous because you have just what's going on with these endothelial cells. They can release all these different types of things to be able to do so many different things. And that's why, generally speaking, we tend to think of vascular disease, a lot of vascular disease now, to be focused on really the endothelial cell itself. And this is sort of typified by what really happens when you have damage to the endothelial cell. So when you have damage from, increased blood pressure, a host of problems, it releases chemicals into the blood that can affect the blood platelets and increase the stickiness, unfortunately, as a defense. But over a long period of time, that defense is unfortunately going to cause some serious problems. What's happening is if there's wall injury, in other words, if there's this endothelial cell, which is the wall, if there's injury there, it can basically cause the muscle cells, these smooth muscle cells here that we saw in that other picture, to migrate and move and signal blood cells to stick to the endothelial cells. And unfortunately, what happens is you end up getting a recruitment of all these inflammatory cells that can cause this plaque in the artery. And as you can see here, the plaque is not covered by endothelial cells. It's covered by a what's called a fibrous cap here. And unfortunately, that's not going to be able to have the same vibrancy that the endothelial cells have. In other words, it has no vibrancy. When I say vibrancy, I mean the ability to communicate and to dilate and to maintain the health of things, because it's no longer there. We have essentially this atherosclerotic plaque. So that's what's really happening with heart disease. So really, the endothelial cells are an incredibly remarkable thing that we have in our anatomy. So we've spoken a little bit about, now we understand how the vascular system is organized. We have spoken a little bit about the diseases that are associated with blood flow, as well as the endothelial cells. So you now know a whole lot. So what really happens with your blood vessels as you get older? So there are many ways of measuring the health of your vessels, but it all really comes down to whether or not you have a stiff artery or you have an elastic artery. Now think about it as an example, going back to the garden hose. Now with a garden hose, let's say you have an incredibly tight garden hose, okay? In other words, it's not elastic at all. It's incredibly stiff. And you turn it on high and you get this wave of water coming into the garden hose. If it's incredibly stiff, it is going to basically just force everything through, force this big pressure wave. It's just going to go down into the garden hose. Now imagine if the garden hose had a bifurcation. In other words, it was coming down and then it was in a split. What would happen is that the pressure wave, that initial force of the water coming through the garden hose, is going to hit the bifurcation with an incredible amount of force. And that can have a great deal of, that can cause damage to those endothelial cells that we're talking about. Now contrast that with an example. Think about having a garden hose that was very stretchy. And all of a sudden I turn on one big pulse. Now what's going to happen is it's going to absorb some of the pressure from the water coming in. And by the time it gets down to the bifurcation where it splits, it's going to just lightly tap that bifurcation point where it splits. And it's not going to create the same amount of force. Now think about that in the body. Obviously in the body, we have very delicate end organs. In other words, think about the kidneys. The kidneys are very, very delicate, incredibly delicate, because when you look at the anatomy of the kidneys, it's really remarkable. It's all these small cells, small little little filtration points that are incredibly, incredibly delicate. Now imagine what would happen if you have this incredible force coming through with this big pressure wave that is going to just, push its way into the kidneys. That can cause damage to the kidneys. The same thing happens in the brain as an example. The brain is also very delicate, and you don't want a big pressure wave going into the brain as well. So that's why having an elastic and stretchy artery is going to be very, very helpful. Now, this particular diagram is basically showing that when blood pressure goes up, you're basically getting, it's associated, essentially with a stiff artery. And normal pressure is associated with elastic artery. These are associated. If you have high blood pressure, unfortunately, because of all the damage done, the artery tends to get stiff. In addition, just having a stiff artery on its own they're also going to cause high blood pressure. So they're not directly related, but they both sort of interact with each other. Same thing here. As you're young, generally you don't have high blood pressure, and you have this elasticity, this stretchiness to the arteries, and therefore you have a healthier, younger vascular system. So here are some factors that we discussed, basically that we've discussed before, that impact healthy vascular aging. Well, nitric oxide, we're going to get into that a little bit later near the end. Reactive oxygen species, those things that are oxidants, we've spoken about antioxidants and how to get rid of those. The immune system health, and sympathetic tone. Now, sympathetic tone we've talked about quite a bit, because we've spoken about the sympathetic and the parasympathetic nervous system. And just the quick summary is that the sympathetic is sort of your fight or flight. And if your body is constantly in this ready state to fight something, which can happen because a guy cuts you off at traffic or you drop the glass on the floor, if you're consistently in this fight or flight mode, that is going to cause your vessels to constrict as a defense mechanism. And because it's getting your body ready to fight. And if you're constantly in a ready to fight scenario, unfortunately, over time, your body is not going to be able to, your vessels are not going to be able to even relax. We spoke a great deal about the vagal nerve a couple weeks ago, and how to increase vagal tone. In other words, how to increase the opposite side of that. In other words, how do we get our bodies to relax? And when we relax, our muscles, our vessels relax. It's a lot of reason why sometimes if you get a massage, or you take a deep bath, or you meditate, or whatever the case may be, you can flush. Sometimes, as an example, with sexual activity, you can flush. All these things are part of the reason is because your blood vessels you're not in a fight or flight mode, and your body is in a relaxed rest, recharge, reproduce phase. And that phase essentially needs to be activated. You can't be in sympathetic tone all day long. That's going to kill you. It's the typical example of that, of course, is the type A personality, the person who is, always fighting, always, always on the go and needs to tackle everything. Well, again, I've talked about it many, many times that we need to be able to incorporate 20 to 30 minutes a day of activating that parasympathetic nervous system to just chill out, relax. That could be, deep breaths, a bath, a massage, a walk outside in nature. We've spent a great deal of time talking about that in other particular classes. So in this really remarkable article by Dr. Nowak in last year, or 3 years ago now, entitled Healthy Vascular Aging, she wrote a review of healthy vascular aging and what lifestyle strategies have been studied. And of course, again, all things make sense, but she listed the evidence that we have. Of course, we know that eating healthy is always going to be beneficial. They haven't done a whole lot of studies that are basically that specifically studied arterial stiffness, but we do know that definitely it increases blood pressure. Flavonoids, which are basically vegetables, pigments of all kinds that are in vegetables, as well as in wine and chocolate, etc. Those definitely decrease the stiffness of arterial stiffness, and it's plus or minus on blood pressure. I did a little bit of extra research on that, and it is mixed. There are definitely some flavonoids like quercetin that definitely have an impact on lowering blood pressure, and others that don't. Flavonoids are a very wide and diverse category. So, and they're broken up into many different categories. So nonetheless, we know that those are going to be helpful. For people who are sodium sensitive, definitely decreasing sodium is going to decrease the stiffness, decrease blood pressure. Weight loss is also going to do both. And of course, aerobic exercise, and that a great deal of work has been done on that. A lot of studies to show that weight loss is going to decrease stiffness as well as decrease blood pressure. Aerobic exercise as well. Okay, so now we have a little clearer understanding of really what's going on with vascular aging in terms of understanding what's happening with the vessels, with its elasticity, with its blood pressure, getting all that together. So you have a very clear understanding of that, very easy to understand, I hope. And now we're going to talk a little bit about nitric oxide, which really rounds out the picture of understanding what vascular health is all about. All right, so as I said, it's a relatively new in science. The 1998 Nobel Prize for Medicine was awarded because the researchers described the effects of nitric oxide, which is a gas, a very tiny gas molecule, had as a signaling molecule within the cardiovascular system. We've spoken about how when, of course, this is coming from the endothelial cells, and when the endothelial cells release nitric oxide, they can cause a signaling. Of course, we spoke about how they signal the smooth muscles. They can signal the endothelial cells through nitric oxide can also act as a signaling molecule in other ways. This tiny gas molecules, we said it's helpful with blood clot prevention, helps with the immune system, and unfortunately, it does decrease with age. So it is important for us to understand what it is and how to keep our levels of nitric oxide up as much as we possibly can. So we spoke about, I showed you this particular diagram before about how it's just this one layer, incredibly one layer of cells, of endothelial cells that are responsible and are going to be responsible for releasing the nitric oxide that's so beneficial that we're going to be talking about. So erectile dysfunction, nitric oxide is one of the main factors that allows for someone to have an erection. And so unfortunately, if men are suffering from erectile dysfunction, it's one of the biggest warning signs for poor vascular function. In fact, in 70% of male patients, it basically is a harbinger, it precedes cardiovascular disease in 70% of male patients. So it's not something that men should ignore. Men should be aware of changes, obviously, of looking into erectile dysfunction. Obviously, there are many different causes of erectile dysfunction from the whole host of reasons. But if someone newly has erectile dysfunction and they're entering the age of heart disease, which unfortunately in this country is 40s and up, then they really need to look to make sure that it's not a vascular issue, because that means it could be a harbinger for heart disease. Now, what's interesting is that there are two pathways in the body. And this is going to be important really for you to understand how to optimize nitric oxide so that you have optimal levels. Dietary nitrates. And what happens is dietary nitrates, which we'll talk about all the foods that have that. Of course, beets are very, very popular. A lot of people know that beets are good for nitric oxide, mainly from all the beet extract supplements. They all talk about commercials and the advertising about how you get nitric oxide. But what's interesting is that in order for you to get these nitrates to be converted into nitrites, which then gets converted into nitric oxide, this step here, this first step, needs an oral microbiome. In other words, if you are using a mouthwash that is all alcohol, like Listerine as an example, those antiseptics or chlorhexidine or whatever the case may be, those are going to interfere with the ability of nitrates in the plants that we'll talk about in just a moment to convert into nitrites, which in the stomach, and the stomach needs normal pH to be able to then create the nitric oxide. So what causes abnormal pH in the stomach? Well, proton pump inhibitors, oral over-the-counter antacid medicines. Unfortunately, a great deal of the US population is on proton pump inhibitors, and that's unfortunate. So if you're using an antiseptic mouthwash and you're on a proton pump inhibitor, unfortunately, even if you're getting your beets and other things, not that there are obviously other benefits to beets besides getting nitric oxide, but it's unfortunate that if you're using an alcohol-based mouthwash and an antacid or a proton pump inhibitor, it's going to be difficult for you to be able to get the maximal benefit from beets or dark leafy greens that we'll talk about in just a moment. L-arginine, which is naturally found, gets converted by an enzyme in the body to nitric oxide. Some people supplement with L-arginine, but by itself, it's not that great. But if for men who are looking for something to help with sexual function, L-arginine in a pretty high dose combined with pycnogenol tends to work pretty well. And a lot of people use that. Meditators, people who are activating that parasympathetic nervous system, that's one way of looking at it, have higher levels of nitric oxide, and exercise increases. Of course, that does make sense. And of all things that affect erectile health, since we've been speaking about that, and specifically, exercise is most associated with an improvement in erectile health. And of course, now that we understand blood flow in a deeper way, from where it leaves the heart to understanding how the blood vessel works and the endothelial cell works, it does make sense, doesn't it? That not just from a nitric oxide perspective, but just from a fact of normal functioning of the body, that these increasing blood flow is going to flush the system out well as going to maintain good elasticity of the blood vessels, hopefully maintaining endothelial cells, which are going to help with nitric oxide, all those things. So it does make sense. Okay, so we've covered nitric oxide and given you some helpful tips about that. And that antiseptic mouthwash, that's something I just learned last month, and I really was somewhat shocking to me because think about it. A lot of us use antiseptic mouthwashes, and unfortunately, that first step is not going to happen. So we're really not getting the benefit of those particular supplements, especially if they're not interacting with the mouth. So the extracts, you really need to keep them in the mouth for a little bit of time. And it's interesting because juicing experts throughout the years forever have always said that you should chew your juice because obviously the saliva is the first step in digestion. There are really some things in the saliva that you really need to be able to interact with the food, especially when it comes to, say, starch. Starch digestion begins in the mouth. With something called amylase that's in the saliva. But remarkably, now we know, as an example here, that the oral microbiome, the natural bacterial flora of the mouth, is fundamental to making sure that we get good nitric oxide. So I just learned that last month and thought it was just so incredibly fascinating because it means that we're going to find more. It means we're going to find other benefits to the oral microbiome. As an example, obviously, people who have periodontal disease have distortions in their oral microbiome as well. And periodontal disease, believe it or not, is associated with a higher rate of heart disease as well as some autoimmune disease. So we really got to get the whole body in order. We can't ignore oral health. It can be very important for the overall health of our body. And this is just another example of that. And as I said, whenever you learn about something new like this, to me, again, one of the things that's so fascinating about it is because it's just the beginning. And we're going to learn more about how valuable the oral microbiome is. So we're going to finish tonight with some foods that can improve blood flow. And we'll start with the natural nitrate rich foods. Beets, we've spoken about before, leafy greens, dark leafy greens, collards, cruciferous vegetables, and arugula it's probably, I think it has actually more than beets. So how amazing is that? Hopefully you like arugula. And all these, of course, we know now have to be chewed well. And we've spoken about before how important it is to chew cruciferous vegetables, especially if they're lightly cooked, to be able to form the beneficial compounds that are trapped in the cell walls. We spoke about the role of the oral microbiome. Many of you are aware of ACE inhibitors. It's a very popular blood pressure medication. Well, they're natural ACE inhibitors. Tomatoes, as an example, are natural ACE inhibitors. Dairy is classically known to have certain peptides that act as ACE inhibitors. Again, you have to dairy is not for everyone. Flax is associated with it, cruciferous vegetables, certain mushrooms. A Japanese sake, which I tend to like, does have some natural ACE inhibitor effect. Ginger as well. So we've spoken about ACE inhibitors, which are going to be helpful. Nitrate, cinnamon, which helps with blood sugar and blood pressure. Pomegranate helps with carotid artery plaques as well as vasodilation. So pomegranates are amazing in so many ways. They did this study where it showed actually opening of carotid arteries, not just literally where people had plaques, the amount of blood flow going to their brain just by doing something like 3 or 3.5 ounces of pomegranate juice per day over like a year really had regression of plaque in the carotid arteries, which is, if you came up with a medicine, that did that it would be like $1 billion medicine. So pomegranate is really an incredible thing, an incredible fruit to keep in mind. Cayenne pepper causes some dilation, and walnuts has L-arginine in it, as well as alpha lipoic acid, which is an antioxidant, and that helps with nitric oxide. So that gives you some. Obviously, again, we've spoken about all these foods before, and just goes to show how these beneficial compounds that we're finding out new benefits to all of these different things each week. And it's just creating the case for why you need to increase the amount of selected plants in your diet, and to create an enormous, bountiful diversity of these things to be able to get the most benefits from all these miraculous chemicals that are just waiting for us to ingest in these foods. I mean, think about how miraculous it is that all these things are there that can cause us to reverse aging in our bodies. Like, they're there to help us live healthier and longer, and they're delicious and they appeal to us visually as well. So what do? We try to get it so that the majority of our food is we're blessed with diversity. We can go to the store and get vegetables from all over the world, fresh fruits from Chile in the winter, and it's really, we're living in a miraculous age, actually, even though we're dealing with so many problems. Nonetheless, the amazing bounty that we have available to us is staggering, really. And when you learn about the benefits, it really just makes you wonder at the miraculousness of having what we have available, as well as learning how miraculous these things are. So as always, my goal is for you to become your own authority in health. And I hope that by going through these things in detail, like I did, obviously we actually only covered these things very superficially. It's always interesting when I prepare these, that I just want to make these diagrams go out and out and out, because it gets even more interesting the deeper and deeper you go in. Of course, we will eventually go deeper into these topics, just like we've been doing in the past. So thank you all for your attention tonight. I hope you really enjoyed that. I know I enjoyed this topic quite a bit. Next week, we'll be talking about how to get your brain into the right state of mind to be able to activate the parasympathetic nervous system. We actually go through many different states of, I guess you could call it consciousness, that are during the day that we're not even aware of. And if we had some sort of control over that, it would allow us to understand the impact of those on our health. And we're going to talk about how to get your mind in the right sort of state to be able to optimize your health. And then the week after that, we're going to talk about, go back a little bit to some anti-aging concepts, which are associated with these cells that are called senolytic cells. Unfortunately, senolytic cells are these cells that we form as we get older that sit there, and they're like little terrorists that are sitting in our bodies, releasing inflammatory chemicals. And they don't do anything, but they're naughty cells, and there are ways of getting rid of them. Lots of different amazing new ways to get rid of them. And we're going to talk about those in detail. I mentioned it once in another lecture, and we're going to go in a little bit deeper so you can get a better understanding of how to get rid of these cells, because they cause an enormous amount of aging problems. So thank you again for your attention. I really enjoyed tonight's topic. I, of course, enjoy all the topics. And I am greatly appreciative of all of you, Dave, Grant, Helen, Lewis, Linda, Russell, Sharon, Sheila, and others. And thank you again for your attention tonight. And I wish everyone well, stay healthy, and I'll see you next week, next Wednesday.